I'm gonna record. Hi, Clementina.
Yeah.
How are you doing with this week's assignment, week 5?
I've not done it. That's the truth. I'll do it.
You didn't
I'll
check
turn
it.
Huh?
You didn't check it out yet, right?
I saw it, but I've not started it.
Okay, no problem.
Yeah.
I know you didn't have a big problem with the calculation, so if you want, you can start. But I told Simone not to start hers until we discuss this once. Patience, I have a question on the board. I want you to tackle it.
Oh, is that the thing? All right.
I want you to tackle it before we start the class. I think I have a full house now. The other lady is not joining today, so I think I have a full house now. So Patience, just try to work out the question for me. Get your pen and your paper. I want us to get our pens and our papers. And it would be nice if we can all come on video. That would be nice. I want it to be an interactive one because I'm going to be working it out myself. So I want us to have our pen and our papers. Let's do this quick. I have apportioned just 30 minutes for this one that we can work it out. Simone, can you come on video? Are you able to come on video?
Yeah.
How about Gertrude? I want us to have an interactive class today. I want it to be more interactive.
Now, with the practical work, question 4. The practical work. The question 4.
Which question 4? Which practical work is that? The one I sent you guys?
Yes, for the week.
Have you finished?
Lesson.
You finished yours?
No, it's 11.
Okay, so when you finish, we'll talk about it, okay? Take notice of all those things that you have problem with when you're answering the questions. Take notice of them and just let me know. So those that you having problems with the 75 weekly, every week we are going to be getting it though. So take notice of those you have problems so that anytime you come, we will talk about it. So let's start working this question. Patience, have you finished?
No.
Finished? Okay. So let's start. A client is to receive 1,000 ml of 0.15% intravenous over 3 hours and 20 minutes using a drop factor of 15 drops per minute. What is the required rate per minute? And they want you to record your answer using a whole number. This is how the NCLEX will always present to you. So Gertrude, just to let you know, we have calculations on the NCLEX and it's part of pharmacology. So pharmacology, they will always bring questions like this. So sometimes it's not too many of them. Other times it's just 1 or 2. And then you're good, you are good. It's part of the pharmacology score that you will get. So the time or the amount to be received is 1,000 ml. 1000 ml. Remember, I sent you the conversion factors. I know I didn't give you the answers to those things yet. I have them today, but let's talk about it, these ones now. So the amount that the client is supposed to get is 1000 ml. And the drop factor or the drop rate is 15 drops per minute, 15 GTT. So GTT is usually assigned for drop per minute. So, and the time for the patient to receive it is 3 hours and 20 minutes. So to calculate the drops per minute, it tells you that the answer has to be GTT per minute. But here they gave us 3 hours and 20 minutes. So you have to convert this into minutes. So 20 minutes is already converted, but 3 hours is not converted. You have to convert the 3 hours into minutes. So to convert the 3 hours, you have to take the 3 and multiply it by 60 seconds. I know this, we would have all known that. One thing about the NCLEX too is that NCLEX will give you a calculator. There will be a calculator on the exam at the bottom of the computer, but that calculator does not do any conversion for you. That's why you need to know the equivalences. That's why you need to know the ratios, how much 1 cc is equal to when they talk of other stuff. So I'm going to do my calculation here. So 3 hours times 60 will be 3 times 60. They don't make you do this calculation off your head. You will have it on the computer. So when I calculated 3 hours by 180, 3 hours by 3 hours by 60 seconds, I get 180 minutes. So I have 20 minutes here. That's the total time the patient is supposed to get it. So when you add it, how much do I have?
200.
Okay, so time is 200. So my time here is now 200 minutes. So total time of 200 minutes. Now let's talk of the formula to calculate drop per minute. So the formula to calculate drop per minute is the volume. Are we taking note of the formula? So we are using the volume of fluid ordered.
Is 1,000.
Times the drop factor. Divide by the total minutes. Drop factor over time in minutes. So the drop factor divided by time. So the time has to be in minutes. That's the formula for calculating drop factor. So in that case, can we put all the work in this formula and then get the answer for me? Can we guys
repeat the formula? Volume.
So the volume ordered.
Right. So the volume
multiplied by the drop rate. The drop rate that is given, or the drop factor.
Right. Divide by.
Drop factor is 15. Divide by the time. The time is 200.
Right.
200 minutes. So make sure you get your answer left after you finish all the division and the cancellation. Make sure your answer that is left in drop per minute, and you round it to the nearest whole number. NCLEX will run it to the nearest whole number. That's how it will come on the exam. So if you have this formula, you can calculate it. So if they give you a drop factor of 60 drops per minute, you are going to use 60 instead of the 15. Now let me just tackle the drop factor a little bit. So with the drop factor, we have the macro drip and the micro drip. So the bigger the number, the smaller the size. So we have a drop factor of 10, a drop factor of 12, a drop factor of 15, and a drop factor of 60. So mostly 60 GTT will be used, especially when they are dealing with children. When they are giving children intravenous fluid, they will always prefer to use that. So most questions that will come and they're asking you to use 60 GTT is usually children, but that doesn't mean they cannot order that in an adult, especially the elderly population. So if they don't want to load the person with fluid too much or too fast, they use this. So, but it depends on what the question presents to you. It doesn't matter how much drop per minute. This is the formula you are going to use. Have we gotten our answer? Can we move on?
Yes.
What's the answer?
75.
5, right?
Yeah.
Who else got 75?
I did.
Yeah, you got 75. Emilia, did you get the answer? Gertrude, did you get the answer?
Yes, please.
We have to be fast on this topic. I don't want us to stay on this. So I have the 1000 cc, 1000 ml times 15 over 200 will be my drop factor. And if you do it well, you really get 75 drops per minute. Are we done? Can I move on? Did we have to round it off or no?
No, it was already a whole number.
Okay, so that's it. But NCLEX will tell you to round it to the nearest whole number. So take notes. Okay, we are going to the next question. Next question. I'm not giving you these questions. I'm just deleting them. Next question. A client with hypothyroidism states that she takes levothyroxine. She takes levothyroxine 0.122 milligram daily. But the pharmacy has issued the drug labeled in micrograms. So this is where you need to know how to convert from from grams to micrograms or milligrams to micrograms. How many micrograms of levothyroxine is equivalent to this? Record your answer in a whole number. So with a question like this, I think my paper is already full. So with a question like this, you need to know how much 1 microgram or 1 milligram is. So if we remember the assignment I gave you, 1 microgram or 1 milligram is equal to 0.001 mcg. Do we remember this? I did give it a conversion rate assignment, if I remember, I did.
Yeah.
Do we know what the conversion is for a microgram?
Microgram to macrogram?
Milligram to microgram.
Oh, mg to mcg.
Yeah.
Is it 1,000?
1,000 watts. 1,000 milligram will be what in micrograms?
1,000 milligrams would equal to 1. No.
Clementina, what will it be? Hmm?
10,000.
I'm just holding the thing. You guys cannot see it.
No.
Okay, so one
10,000.
milligram, 1 milligram is equal to 1,000 micrograms.
No,
No?
no. Micrograms, micro. Remember the word micro is the tiniest of all. You're not talking of macro, you're talking of micro. So it's going to be opposite of that.
So it's, okay.
It's 0.001. So
Oh, wow.
1,000 milligram is equal to 0.001 microgram. Are we getting it?
No, say that again, please.
1 milligram is equal to 0.001 mcg. Are we getting confused?
No.
If you have 1,000 milligram, that's where you will say it's one gram. So don't bring milligram or grams. This is milligrams. 1 mg is equal to 0.001 microgram. Micrograms are tiny. It will always come in 0 point something something. But when you convert it back to milligrams, then you get it as a big whole number. So when you are converting, that's where you get it up to 1,000, but it's not 1,000. Simone, are you getting it? If you don't get it, let me know.
Yeah, I will.
Huh? So for you to get the microgram at 0.001, you have to take the number 1, you have to take 1 divide by
1,000.
1,000, and you will get it as a microgram. Okay?
Okay.
Yeah. So for each 1 milligram is equal to 0.001. I can't even get the one I'm talking about. It's here. Okay. All right. So if they say the client takes she takes levothyroxine, so the amount of the drug is 0.112 milligram daily. But the pharmacy has issued the drug labeled in microgram. So the patient takes the medication in milligrams, but the one the pharmacy brought is in micrograms. So how many levothyroxine is equal to this? So if you know that 1 milligram is equal to 0.001 mcg, how much is 0.112 milligram equal to in mcg? Are we seeing the calculation I'm doing? Is my writing clear? Clementina, I can't hear you. I see you are talking.
Yeah, I said, is that not what you write it on the whiteboard?
You said?
That's a what to write on the whiteboard.
Which whiteboard? On the screen here?
Yeah.
Yeah, I can write it there, but I don't want to write it there. I want us all to be doing the calculation ourselves. You know, I have the marker. You don't see this one?
No.
No.
Huh?
No. No, it's not. It's not. No.
Okay.
It's really very tiny. Nobody can pick it.
Oh, really? I'm using a marker, a big one. Okay. Yeah. I want you to have a paper and we are working it together. I don't want to do it on the screen and that's it. So let's work it out this way. So 1 milligram is equal to 0.001 mcg. Write that one.
Yes.
So 1 milligram is equal to 0.001 mcg, right?
Yeah.
Yes.
Now, how many milligram will 0.112 milligram? Or how many micrograms? So it will now be X mcg. So the X is representing the amount of this in micrograms. Do we understand?
Yes.
So in that case, you cross multiply. I know they have a formula that they use, but I'm telling you the easiest way and you all arrive at the same answer. So you multiply this one by this, right? If you don't want to be confused, just carry on with the thing. So what is it? If I multiply this by this, what do I get?
You have 0.112.
I will have 0.112. So they have a micromilligram here. This is not writing well. And they have a mcg. I'm putting all the things so that for those who don't understand the calculation, we see how the units are all going to cancel each other. So x mcg multiplied by this will be the same. We all know our basic mathematics. So we are going to have the x, we'll have our x mcg. So these are really the easiest thing that I want you guys to understand, so that in your practice, you don't need to keep going back to them because you have a lot to learn for the NCLEX. Then the next unit is the MCG, right? Oh, it's MG.
MG.
So yes. So in that case, the units are now going to take off each other. But the one we are looking for, this is milligram, this is microgram. And this is microgram, this is milligram. So the one we are looking for is this one. We are looking for this one. So if we are looking for that one, then our answer is this one is going to take off. This one is going to take off this. When we multiply the microgram and the milligram, it takes away the milligram, because we are looking, this one has come to mix with this. So that means we have converted, we have compared. So if one of this is equal to this, the amount of this will now be equal to this, because we're supposed to divide it by one. And you know, when you divide anything by one, it's still the same number. So at the end of the day, our answer is going to be 0.11 mcg. 112.
112.
Yeah. So our answer is going to be 0.112 microgram. Do we understand the calculation?
I don't understand.
Wait,
don't
but
understand.
what's the answer you got? Because we're multiplying by two decimal numbers. So the answer has to be 6.
Actually, the
Placeholder.
answer, yes. So I'm waiting for you guys to
Okay.
give me the calculation. I didn't do the calculation myself.
Oh, okay. I was
So I
a
thought
little
you guys
confused.
told me it's 0.112. I'm not
No.
calculating. Okay.
Oh no, it's 3 zeros 112. 0.3000112 mcg. No.
Hold on. What did you say?
So the answer I got was 0.000112 micrograms.
So if we have one milligram, right? Is it
Right.
milligram or microgram? Milligram. So
1
1
milligram
milligram will
is
contain
0.001 micrograms.
I'm confused here.
I had the same answer.
You had what? What did you get?
The same answer, 0.000112.
It's not supposed to be. It's supposed to go the opposite. The answer is supposed to go the opposite. So instead of the 0.112, it's supposed to be 112. That's supposed to be the answer. So let's do the calculation again.
Wait, so patience, that's what I was initially saying, that if 1 milligram is equal to 1,000 microgram, because initially when I researched, that's what it says, 1 milligram is equal to 1,000 microgram.
Yes.
But you're saying it's not a whole, it's not micro, it's not 1,000, it's 1,000, like 1 over 1,000.
Then maybe I'm confusing myself.
Yeah, so if
Yeah.
that's the case, then we would have arrived
Oh,
at
I'm sorry.
100,
1,000, 1 milligram. 1
Right.
milligram is equal to 1,000 microgram.
There we go.
That's what makes it tiny. Yeah, I'm sorry.
Okay.
I confused everybody. Yes,
Okay.
that's a pregnancy brain. Okay, so 1 milligram is equal to 1,000 microgram. Yes, so that's correct. So can we now calculate it and get the answer?
Okay. So now the answer would be
1,000 what? Milligrams.
no, the answer would be 112 micrograms.
Yeah, that's
Okay.
the answer. But do we know how we arrived there? Because I know some people didn't get it right.
I got the 00 in front, but when you converted it to the 1 milligram to 1,000, you said 1,000 what?
Microgram.
Did I say something about 1,000? This is it. 1 milligram is equal to 1,000 microgram.
Yes.
Yes.
So that's the conversion. So 1 milligram is equal to 1,000 microgram. So if 1 milligram is equal to 1,000 microgram, then we cross multiply them. And when you cross multiply, you get 112 microgram. Can we move on?
Yeah.
Did we get it? Gertrude? Is Gertrude on?
Yes.
Did you get this one?
Yes.
So if I give you a question, will you be able to calculate it?
Yes.
Because it will not make sense if we are not able to, and we keep quiet and then we continue moving. So just let me know. Did I change my screen? I was trying to change it. Do we see a different screen? Do we see the question back?
Yeah.
Yes.
Okay. So I can go now. Now, question number 3. That's my question. Question 3. So question number 3 is a drag and drop. It's a drag and drop. But because the system, I don't know how to design the system to give you the drag and drop options. So for the NCLEX, the drag and drop will have a table for you. They will give you a table for you to drag and drop. So let's take this one as our table. 1, 2, 3, 4, 5. Okay, so this is our table. Gertrude, the NCLEX has a drag and drop questions. So with the drag and drop, they usually look for simple or basic procedures. They can look for a procedure that can be assigned to the unlicensed personnel, and they want you, the nurse, to drag them and drop them in order. They can ask you how to take temperature. They can ask you how to do a finger stick. They can ask you how to check a blood pressure. They just want to see if you know the process yourself. Or they can ask you the process to teach a patient who is being discharged. So with this question, it was a drag and drop. It's not a calculation question. So we are not doing calculation with this question. We are just dragging here and drop. So what do we think? Who can start with the procedure for me? Who has an idea? You want me to read the question? The nurse is instructing a client who has had an eye removed in the proper procedure for inserting a prosthetic eye. Place the following steps of prosthetic eye insertion. So for you to place this correctly, you should know the process, or you should know about the ophthalmology. You should be an ophthalmologist. You should know about the eye, the procedure that they will use if a patient has the eye removed. And now they want to put it back. What is the procedure? So the first one, let's read the answer options first. Raise the upper eyelid, pull the lower eyelid down, slide the prosthetic under and behind the upper eyelid. Identify landmarks on the prosthetic eyes for the inner and outer canthus, superior and inferior aspect. Check the position and cleanse the prosthetic eye according to manufacturer's direction. Listen, guys, so this particular question is straight. It's an LPN question. It's not RN, okay? It's not for the RNs alone. It's LPN standard. That doesn't mean RNs cannot get it, but I'm just letting you know it's LPN standard. So don't think it's too difficult for you. You are supposed to know something like this. So the first one is number, is that 5 or 6? Is this one 7 or 5 or 6? I don't know Roman numbers.
Yes, 6.
So help me out. So with a drag and drop, you are supposed to click on it and then you should be able to drag and drop. So I'm not able to click on it and drag and drop. I'm going to copy it, or I'm going to cut the whole thing so that it come out. So let me see. Okay. So this one is the first step you will do. You have to cleanse the prosthetic eye. So this is the first step. I think. So you cleanse the prosthetic eye first. Then you identify landmarks on the prosthetic eye for the inner and outer areas and the superior and inferior aspect. That's what you are going to do. This is number 4. So that is the second step that you will do. What is what?
Okay.
The thing, I think the thing messed up because I picked the other one, started mixing up the answers. Okay. I'm going to delete this one. Okay. So Ivy. So because the system, I'm not able to fix it such that it automatically give you a drag and drop. That's why I have the Roman numbers there for you to be able to drag and drop. Now, our next action is to how the procedure itself is done. You want to now raise the eye, the upper eyelid. So after you have cleansed the prosthetic eye using the manufacturer's directions, you want to identify landmarks on the prosthetic eye. That means you are just checking it. You are going over it to check and see whether it has all the parts that you need to have for the eye. So you check the prosthetic landmark for the inner and outer areas and the superior and inferior aspects. So you want to see, does it have all the things I need for a normal eye? Then the third one is for you to, now you have finished checking, you have used the manufacturer's procedure, you have checked it out, and now you are about to insert it. Because when you look at the other options left, is to raise the upper eyelid, pull the lower eyelid down, and then the next one is slide the prosthetic eye under and behind the upper eyelid, and then you check the positioning. So basically, you know that before you check positioning, it will be the last thing after you have inserted to make sure it is properly done. So number 1 is the third action that you will do. Oh boy, it's mixing up the numbers and I don't like it. So number 1 is the third action that you will do. I'll copy it, I won't take the whole thing. So I comes next. Then the 4th action that you will do is now slide it. It's now to slide the eye inside. So after you have raised the upper eyelid like this, you know, they are able to raise this. If you have ever been to the eye clinic, they raise the whole of this thing and they leave the socket.
I'm on the Zoom meeting now.
So, the next one is to slide it inside. That's the 3rd procedure. Clementine, are you getting the procedure right?
Yes.
1, 2.
I can't hear you well. Please come again.
You can't hear me?
It's 3, you made it 2.
Oh, okay. 1, 2, 3.
Yeah.
Okay. So after you have slided it inside behind the eyelid, then you want to pull the lower eyelid. So when you pull it up like this, and you take this one and turn it upside, you flip the upper eyelid upside down, and then you have the whole socket open. So you push it inside, and then now you are bringing the down one to be able to have it fit in the lower aspect of the eye. So this one will now, this step here will now be, because I didn't delete the other ones, pull the lower eyelid down. So now this is the next step. That's number 2, right? So number 2 will be our next step. So you are now pulling it down. After you have finished sliding it inside, you now pull it down. And then our last one is to check the positioner. So you have finished everything. You want to check and see whether it is well positioned. You want to make sure you have fit it in very well. And you are done with your procedure. So that one is the 5th option. Okay. Do we understand it?
Yes.
Any
But
question?
I have a question. Why would you cleanse it first before you identify the landmark?
Why would you cleanse the prosthetic eye? So with the prosthetic eye.
No. Before identifying the landmark.
Cleanse the prosthetic and prosthetic check prosthetic eye according to something is not right here. Check the position. Here it's mixed up. It's cleanse.
Oh, yeah, it came back. It came back. If you click, it just come back. You know, it's what? It's what messing you up there.
Okay, so cleanse the prosthetic eye according to manufacturer's direction, right?
Mm-hmm.
Right.
And then your question is what?
No, I said, why would you clean it before you do the before you identify the landmark of the prosthetic eye?
Yes. So the landmark of the prosthetic eye, you are identifying it in connection with the patient's eye. You are using your knowledge of how a normal eye should look like. So you have the eye right in front of the patient. You are ready to give it. You have already identified your patient and all the surgical procedure. It's like in the surgical process, you are ready to give it out to the provider. Ideally, nurses don't insert this. It should be that ophthalmologists who do it, but they want you to know the procedure that will be done. So you are giving it out. You are not the one inserting it. So you cleanse it out, and just before the procedure is inserted, the one that is going to actually insert it inside has to look at the landmarks. He has to look at the shape of the eye, and then look at, you have to know the normal eye of a human being. So it's not actually like you are doing a real identification of who the patient is. You are just doing the landmark to make sure that it's the eye that is like the structures. You have the inner portion that will fit. You have the contours, you have all the layers in place. So you are checking the landmark to make sure that it has all the inferior and all the superior structures intact. So it's not a checkup that you do to see that, is that the right patient? Is that the right eye? Is the checkup you are doing?
I understand that. But what I'm saying is, why wouldn't we do that before we cleanse the prosthetic eye? Why wouldn't we check that before we do the cleansing of the eye? Because once we cleanse the eye, then it's pretty much time for you to start the procedure. So you wouldn't want to clean the eye and then you want to identify the landmark to make sure everything is there. You would want to do that. I think you would want to do that first, cleanse the eye, then you continue with the process. So that's where I'm a little bit concerned. Like, why would you cleanse the prosthetic eye first, then you would check the landmark afterwards?
Yes, so that's what I'm saying. So checking the landmark is not to infect it. And it doesn't mean you have that much time to infect it. You have finished cleansing the eye with the manufacturer's instructions. So the manufacturer said you have to use this and that and that. So remember, it's a sterile procedure you are carrying out. So after you have finished everything, you remember when they are doing surgery, this is going to be the same thing when they are doing a surgical procedure. Let's say they're doing a laparostomy or laparoscopy. They have to cleanse the area, they scrub the area, they do the scrubbing and the cleansing and everything before they mark a line of where they are going to cut. And the moment the line is marked, that's the time they do the cutting. You don't come back to now start, you don't mark it and come and clean. So it's like a standard order of how to deal with the prosthetic eye. So before you check the landmark, you would have cleaned it and everything is in a sterile environment. So when you are checking the landmarks, you are ready to have it fit in. So it's a standard order of procedure that has to be done.
Okay.
Have you ever seen a surgical procedure?
Checking the landmark, yes. So that's why I have that question. So pretty much checking the landmark, that's a part of the sterile process.
Yeah, it's part of the sterile procedure. It's not time for you to now go and be marking it and checking where is it going to fit. No, after you have done the cleansing. So after everything is all sterile and clean, then you now landmark it and then you are ready to push it inside.
Okay, got it.
Yeah.
Okay.
Okay, can I move on?
Yeah.
So our next question takes us back to mathematics. Did everybody get it? Does anybody have a question? Hello? Can I move on? Okay, so our question number 4 is calculation again. Following surgical repair of a fractured femur, a client's hemoglobin falls to 7.4, and the physician orders 1 unit of packed red blood cells, into bracket, each 1 unit is 250 ml, to be administered over 2 hours with a drop factor of 10 drops per ml. What flow rate is needed? Record your answer using a whole number. NCLEX will tell you, record your answer or round your answer to the nearest whole number. Round your answer to the nearest. This one we can calculate it, so I'm waiting. It's the same thing. So the calculations on the NCLEX are basically in the same format. They don't trick you with those things. All they want is for you to convert something before you use it. So get your conversion factors or conversion ratios right. All they want is for you to be able to convert something before you be able to answer the question right. So read this question 21. And then formula. Okay, Clementina, I heard you. Gertrude, what's your answer? I want you guys to calculate this one. I'm not doing this calculation. It's the same format. And this is what NCLEX will do all the time. So they are either giving you the CC for you to convert it from milligrams to CC to ml, or you convert the timing to minutes. That's what they will always ask you for drop rate and all those things. So they are not going to crack your head too much if you understand the formula and the conversion ratios. So I gave you the formula is volume times drop factor over time in minutes will give you the drops per minute. Volume times drop factor divided by time in minutes. So what's the answer? Patience. You finish? Emilia, what's your answer?
Yes.
What's your answer? Gertrude?
21 drops per minute. 21 drops per minute.
Okay. Simone?
I get one.
Huh?
I get one.
You got one? It's not correct. So the formula again, I'm writing it. Volume times drop factor. And the drop factor, oh, it's underlining. The drop factor divided by time in minutes will be, that's the one that will give you the drop rate.
So what would be the volume here? That's what that's
what would be the volume?
Let's give you the volume. The one you are given is the blood. And the volume is, they gave you the volume. Put it in brackets to make you know that a pack, 1 unit pack of red blood cell come as a 250 cc. So in this question, if they want to be more tricky or super tricky, they will not even give you the volume as 250. They'll just tell you to receive a pack, 1 unit of packed red blood cell. So 1 unit of packed red blood cell has a standard volume and it's 250. So for each packed red blood cells, if you have watched the video I made on, I think, blood transfusion, I think if I remember, I did mention the volume of blood in a packed red blood cells and how much it should come with.
Can I give you my answer now?
Yes, I am positive.
21.
We did it. And that's how NCLEX will do it. They are not going to, those questions are not too tricky. You just need to know how to convert it. They don't go.
So you want to, I was going to tell you where I was a little confused was when I saw that the hemoglobin falls to 7.4. So I was thinking of that, but okay.
No. So they say a client hemoglobin falls to 7.4 and the physician orders. That means it was seen and there was an intervention. There's a solution to take care of the 7.4. So they are not worried about the dropping of the hemoglobin. The amount of the hemoglobin is not a problem now. They want to know how much drops or how much flow rate you set the machine to give the patient the blood. That's the interpretation of the question. So they just want to know. So with this one, you are supposed to give it for over 2 hours. It should be more than 2 hours. So starting from 2 hours is 21 drops per minute. So over 2 hours, you don't care. They didn't tell you how many minutes after the 2 hours, but they gave you over 2 hours. So it should be given for 2 hours. So 2 hours, you convert it to minutes. And you use the pack of red blood cell because that's the one, when you hang it on the pump, you are going to regulate the flow rate. So just take it like you are the nurse standing on the floor and you are going to give the patient blood. So the doctor said, the pack of the 1 pack of blood that you are going to give to the patient, I want the patient to get it for only 2 hours. I want it to go to the patient, like I want it to be delivered for 2 hours. So don't rush it. Don't give it in 1 hour. So set a drop rate and work out. That's what the doctor will tell you. So you are standing by the patient, you have to go and calculate it. So just to let you know, with blood, you will always calculate the drop minute, even if you're on the floor. It's not something pharmacy will calculate it for you. Blood comes from blood bank. And even if you are the nurse on the floor, for blood product, you will always have to calculate the flow rates. So it's not only for NCLEX, but if you see the nurses on the floor, that they have to calculate all the time. So if they don't tell you the pack of blood is 250 cc, then you have to contact the blood bank to know how much is in the bag. Or sometimes you have to look at the bag and know how much volume. And other times, if you don't find it, you don't have a reliable information, you have to contact the laboratory to find out the standard volume of that unit of blood that they are delivering to you. So for blood, you will always calculate the flow rate for blood. So take note, okay?
All right. I have a question. The doctor normally will not give you the flow rate, but I can tell you the time duration.
Yes, the doctor will tell you. Yes, the doctor will tell you, give it after this minute. Sometimes the doctor will not even tell you, they just put the order there. They put the dose, the quantity of blood. I want the patient to get 2 units, and the 2 units has to be given in 2 hours. Or if it's a rapid infusion, they can tell you, give it in 30 minutes, give it in 45 minutes, give it in this. So the doctor will tell you how much time they want, but they will not tell you how much to calculate. Even medications, that's how
so it is you now that will decide to run it at whatever.
Yes, you have to set it on a pump. You have to set it on the drop rate. Like when you are given the delivery set. So when they bring the blood delivery set, you connect it on the blood, you prime it with the normal saline. You have to set it up to meet 2 hours. So that's why you have to do the calculation. It's a nurse's responsibility for that. Doctors wouldn't give it up. They just know, I want it to be given in 2 hours because I don't want to overload the patient, fluid volume overload. So I don't want it to overload. It's an older patient. I don't want the patient to be loaded too much. So I cut it off. Okay. Now let's go to the next question. An infant is to receive 250 ml. So when you start reading NCLEX calculation questions, you want to take notice of the units they are mentioning as well. Because if you need to do conversion and you miss that point, you are going to miss that question. So here they said an infant receive 250 ml. And mind you, on the NCLEX, they will also give you a paper for your rough calculation. You don't send anything into the room. You walk in like that, for those who haven't been there. So when you walk in, you have to have eraser. So if I am the student and I'm reading this question,
Excuse me. There's a background noise. Is it one of us? We can all mute our lines.
Hold on, I'm trying to figure out who it is. So all right. So I'm just going to mute everybody. If you want to talk, just unmute yourself. Okay. So we have, if I am the student and I'm answering this question, an infant is to receive 250 ml of D5, dextrose 5% in half normal saline. This is what the patient is supposed to get. So what I will write is the patient will get, patients receive, or patient to receive 250. I'm doing that so that I don't get confused as I read the question. The doctor wants the patient to get this, so I write that down. But this is the name of the solution that the patient is going to get in 5 hours. So the time to give. I'm telling you how I would do it. And I think you should do it the same way. When you start reading the question, don't finish reading it before you come back and start analyzing it. You always, because your mind is already up to something, you are already occupied with a lot of thinking in that exam. So in 5 hours, so the time to give is 5 hours. So that's how I will write it. The time to give is 5 hours. Then the pediatric IV system has a drop factor of 60 drops per minute. So this is a pediatric and it's 60 drops per minute, 60 GTT. So what is the flow rate? Record your answer in a whole number. So if you look at this question again, the only thing you have to do is convert time to hours, hours to minutes. That's the only work you have to do. So can we do that again? It's pretty much the same question. Because the NCLEX comes with a lot of practice. And when it comes to some of these questions, you have to practice them. That's why I want you to put hands on. So the total volume of fluid is 250. Total volume is 250. Okay, thank you. I see 50. Okay, can we calculate? If you want to, if you have your answer, you want to talk, just you can unmute yourself and then you tell me.
50.
So Clementina said 50. Simone said 50. What did you get, Gertrude? What did you get, Patience and Emilia? You say? Are we done? Be fast now.
Yeah.
Just use your phone as a calculator. It's committed. Huh?
50.
Everybody got 50. Okay, let me also do my calculation and see how much I get. So I have 250 times 60. 5 times 60 is 300. Over 300 is equal to what? So I have 60 divided by 300. So 0.2 times 250. I have 52. Okay, so I'm going to move on. Did we all get the answer correct? And do we know why we arrive at 50? Who doesn't get it? Huh? Who has a question? Because I'm going to move on. I didn't want us to spend more than 30 minutes on this. Who has a
explain it? Yes, explain it a little bit. It's as if
we did a lot of calculations on the drop per minute. So it's the same trend. The formula is still the same thing. Volume times drop per minute over time in over time in minutes will give you the drop rate. So for this question, it's going to be 250 ml as the volume, and the drop rate is a pediatric one. I had mentioned that mostly 60 they'll use it for pediatrics or some grown-ups who are very old and their hearts cannot endure a lot of fluid volume within a short period of time. So they will use the GTT, but mostly in pediatrics, you'll hear 60. Adults, they want to use a bigger delivery set. So the volume, the drop rate is 60 and the time is 5 hours. So you convert 5 hours in minutes. So 5 times 60 and you'll get 300 minutes. So 5 hours will give you 300 minutes. And then you take 60 divided by the 300 minutes, which is 0.2, and 0.2 times 250. So I'm done. Any question? Can I move on? Can we start working on the next question for those who are done?
Yeah.
Simone, I have the next question going on for those who are done. Emilia, I'm still waiting for your answer. So a child who weighs 40 kilograms, this one is taking you to a different dimension. A child who weighs 40 kilograms is prescribed clarithromycin, 15 milligram per kilogram day for 10 days in divided doses for acute strep throat. If the medication is provided in suspension with 250 ml, how many milliliters of the medication are required to complete the treatment? I like questions like this. Who is going to give me a try of how the calculation should go? Any volunteer? Clementina, did you get this one correct? I don't remember.
I'm not sure I did. I'm not sure. Yeah, let me see.
What do you understand about this question?
You have to work out the kg first.
You have to do what?
Work out the kg.
You have to work out the kg first, yeah. And
then multiply by. No, this one I don't know.
This one you don't know? Okay, so a child who weighs, so the child's weight is 40 kilograms, has to take the medication 15 milligram per kilogram per day. So for every day, the child has to take up to 15 milligram for 10 days. The medication says give the child 40 kilogram. And the child's weight is 40 kilogram. But for every single day, the prescribed clarithromycin 15 milligram per kilogram per day. So for every child who weighs 15 milligrams should take 1 kilogram should take 15 kilograms per day. And this child is supposed to get this medication, this 40 kilograms for 10 days in divided doses. If the medication is provided in suspension with 250 ml. So this tells you that this one and this one has to be converted to be able to work it out with this. So the pharmacy has brought the medication as this. So the medication is in a bottle like this. And they tell you for every 250 that you pour inside this thing. So every 200, and if you pour inside this thing, this cup, you fill it up, it's going to be 250 milligram and it's 5 ml. So the calibration on the medication cup is 5 cc. So when I pour 5 cc, the 5 cc is 250 milligram. But the medication for every 1 kilogram or every 15 kilogram, but the child's weight itself is 40 kilogram. So, and for every 1 kilogram, I have to give the child 15 milligram. The child is more than 15 kilograms, but for every 1 kilogram, the child can take up to 15 milligram of the medication, if I'm making sense with this. So for every 1 kilogram in 1 day, you can take up to 15 milligram of the medication. Now this child is weighing up to 40 milligram. Do we understand? So this is how we are going to calculate it. So it's going to be, we want to get it in milligrams. We want to get how much milligram the child should take, because we have to put it in milligram before we end up calculating it in cc. So we have to use the weight here plus the daily weight. Daily recommended weight for this medication is this. So we have to use this one and this one to be able to calculate this. So if I am you and I'm in the exam, this is what I will put. So the medication came as 250. Let me put it here. 250 milligram is equal to 5 ml. So now the child's weight is 40. So 40 kilogram. I will multiply the 40 by 15 kilogram per what? 50 milligram, right? Milligram per kilogram. Do we get it? Are we getting this?
Yes.
Because I want to get the total of how much 40 will take. So for each 1 kilogram, the child can take up to 15, and the child is 40 kilograms. You understand? So this one is assumed that for every 1 milligram, the child can take, oh, that's 1 milligram, the child can take 15 kilogram of the 15 milligram of the medication. Do we understand? So if I wanted to take this one off, I will do it this way. This is another way.
It's 1 kg, not mg. 1 kg equals to 15 mg.
Correct. Thank you for correcting me. So for every 1 kilogram, the child is supposed to be given as 15 kilograms for 1 day. Okay? So in this case, what I do is cross multiply. You do the cross multiplication again, like I told you. So you cross, don't worry about this one on top there yet. So you cross multiply this. You understand? But here I put times. So this one, don't worry about this one. This is how I want to frame the question. So for every 1 kg is equal to 15 milligram. 40 kg will be how many? This is how I want to frame the question. I didn't frame it right in the beginning. So this one, I put it there, leave that one. I was calculating that one. That's why I put the times. So leave this one. We are calculating it to get the answer. But another way to do it is, if 1 kilogram is equal to 15 milligram, how many milligram? 40 milligram will give us, no, 40 kilogram, that's the child's weight, will give us how many milligram? So this is how I want you to look at the calculation first. That's how you have to convert it. But you need to understand the question first. Simone, do you understand the question?
Yeah.
Yes. So the question is asking you, the child is, you brought your child to the emergency. Your child's weight is 40 kilograms. And the doctor said the patient is 40 kilograms, but that's not my problem. But the medication I want the patient to get daily, I want the patient to get 15 milligram per kilogram each day. For every 1 kilogram, I want the child to get 15 milligram of the medication. So the doctor will put 15 milligram per kilogram. So 15 milligram for 1 kilogram. Are we understanding?
Yes.
If you don't get it, just let me know. So for 15 milligrams, it should be, the weight should be 1 kilogram. Now this child is weighing up to 40 kilograms. How many milligrams of this medication will this child get? So in this case, you cross multiply. Can someone do the multiplication for me? So you cross multiply and let me know how much milligram the child should receive. Now, when you get the amount of milligram the child should receive, it makes it easy. So you have to start the conversion from the milligram per kilogram per day before you move on. Gertrude, are you getting me right?
Yes.
Is somebody doing the calculation for me?
Yeah, it's 600 milligram.
600 milligram, right? So the child is going to get a total of 600 milligram in 1 day in divided doses. So the child is not taking everything now. It can be morning, afternoon, evening. So you want to make sure that for the whole day, the child gets up to 600 milligram based on the child's weight and the order to be given for every kilogram. So now, if we know this child that is weighing 40 milligram will take 600 milligram, and they tell you the medication comes as 250 milligram to be 5 ml. We want our answer in ml. So now we have 600 milligram as the child's weight. Am I correct? Am I correct? Nobody's answering. We get 600 milligram for the child's weight, for the amount the child should take based on their weight. So the 600 milligram is based on how much the child weighs. So if you were weighing 75, we would use 75 to multiply it by the daily recommended dose. So now we are going to calculate the amount in ml. So if you are supposed to take 600 milligram for the whole day, how many cc should I give in the morning? How many cc should I give in the afternoon? That's the divided doses. from the question. So you should not give all the 600 milligrams at 7 a.m. The 600 milligrams is supposed to be given for all day. So if I take up to 600 milligram dosage for today, I'm done for the day. So you are not supposed to give it to me everything at once. It's supposed to give you in divided doses. So now let's see in divided doses. So divided doses, the medication said for every 250 milligram you will take, it should be given as a 5 cc. So I pour it in the cup as 5 cc. So if that one is 5 cc and the child is supposed to get 600 milligram, how much of this will I give to the child? So you cross multiply this for me. Can somebody do that?
It's 12 mils.
Is it 12 mils?
Yes.
So for 600 times 5,
That's 3,000.
Who said 12 mils? I'm not sure if it's correct. That look like it's too small. So for 600 times 5, okay, 600 times 5 is what?
3,000.
Correct. So we are going to have 30 is 30,000. Can you do the calculation again?
No, that's 3,000.
3,000.
You got 3,000?
That's 30,000. 600 times 5 is 3,000.
600 times what now?
Oh, okay. So here's the problem.
Times.
Yes. So here we got 600 milligrams, but we forgot to add the 10 days. The medication is supposed to go for 10 days. The medication is supposed to be given for 10 days. So we didn't calculate, we didn't put that one in mind. So we only calculated the amount for the child's weight. So this is the amount the child will take every day. But for the 10 days total, how much would that be? That's what they want you to calculate. So for 10 days. So remember, each day will be 600 milligrams. So for each day, the child's weight being this, the child will be getting 600 milligrams, not 15. Do we understand? Because the 15 is for every 1 kilogram per kg. And the child is 40. So for the 40, every day the child will be getting 600 milligrams for 10 days. Do we get it here?
Yes.
So multiply the 600 by 10 first before we cross multiply here. So we have to add it here. So we have to multiply that. After we have gotten at 600, it has to be given in 10 days. So if you use only this one to calculate, that will be 1 day medication. But the child will take the whole medication for 10 days. So how much of the medication should I put? So that's what you want to do right now. Okay?
Okay.
So multiply 600 by 10 to make it 10 days for the medication. The child is taking it for 10 days. And let me know how much it is.
1,000. 600 times 10 is 6,000.
600
multiplied by 10 is 6,000.
6,000.
So it's 6,000 here. So now okay. Okay, so we have the 600 by 10 and we got 6,000, right?
Yeah.
So now that we have gotten this portion, let's move down. So we have finished. You have finished calculating for the child's weight. Now it's 250 ml for every 5 ml. Now 6,000 will be what? So now we are using 6,000 to calculate the total amount for each time we are giving the medication. So now calculate this one and let me know the answer. Cross multiply and divide. So you are multiplying 6,000, 6,123 times 5, right? Will give us 250 milligram. Are we getting it? We have to be fast.
Yeah, it's 120 mils.
It's 120 mils. That's the answer. So this is 6,000 by 5. It will give us 30,000. So we are going to get 30,000. And then we divide the 30,000 by 250. This one here. And our answer should be 120 cc or mil. Do we get it? Can I move on? We're not talking. We're spending too much time on this. So can somebody read the question again? And let's see if we make meaning out of it. If you were sitting in the NCLEX room, in the exam room, can somebody read the question for me?
A child who weighs 40 kg is prescribed clarithromycin 15 mg per kg per day for 10 days in divided doses for acute strep throat. If the medication is provided in suspension with 250 ml per 5 ml, how many total milliliters of medication are required to complete the treatment? Record your answer using a whole number.
So who can explain the question? If it was in the NCLEX, how will you interpret it in your own way to understand it? Or I should move on? Without calculation, I'm not saying you explain the calculation aspect, just explain how you understand this question. Okay, so the question says the child's weight is 40 kilograms. So you are the nurse, you have the child's weight recorded. So the order that the doctor is going to put in the computer will be 15 milligram per kilogram per day. Give it for 10 days. That's the doctor's order. So this is what the doctor is going to order, and that's it. This one is delivered from pharmacy. So you go to the pharmacy, you pick up the medication, and this is what they wrote on the medication. It's left onto you to go and get the child's weight. So you went to the patient chart, or you went to weigh the child, because the order says should be 1 kilogram should be given 15 milligram for 1 day, and you want it for 10 days. So for each 15 milligram per kilogram for 1 day, the child's weight comes as 40. So how many of 40 milligram per kilogram will you give for 10 days? So that is the calculation we have done here. So for 10 days, the child will get 120 milligram, the 120 ml. So 120 ml is what the child will be getting on a daily basis for 10 days. Does it make sense? Can I go on? Simone, do you understand? Hello? Patients, do you understand? Huh?
But not everything.
Because you have the child sitting there. She's going to be disturbing you. Send her out and lock the door. Let her cry outside, because she's going to be disturbing you. You are going to miss a lot. Sometimes it's not because the child, it's not because you are not understanding, but you cannot really focus if you have them around you. They play too much. because they are sitting there and they are doing stuff, and you are worried about their safety. So it's not going to help you. So get something, keep her busy somewhere. And when she step out, then you off it. Okay.
So I was confused about how you get a 600 mg, because when you calculated and we multiply the 40 by 15 is 40 kg, and then that's the unit. So when we arrived at the 600 mg, yeah, that was where I was confused.
Okay. So let me put on my pointer here. You have your phone there or a calculator? So calculate this for me. 40 times this. And tell me how much you get.
Yes, I got a 600, but the units, I'm confused about the units.
You're confused about the units?
Yes.
Okay. So this is 250. The medication comes, okay, let me leave this one. It's not part of this yet. This one comes at the end. So the child's weight is 40 kilograms. The medication is for 1 day, every 1 day, the child should take a maximum of 15 milligrams. So 15 milligrams is equal to 1 day. You understand? This is the day I'm trying to spell, okay? 1 day. So for every 1 day, the child has to get 15 milligram for every 1 kilogram. Do you understand? Do you understand this portion?
Yes.
Now the child's weight is 40. So I'm going to use this one and I put 40 kilograms here. So this is 40 kilograms and the child is supposed to take the medication for 10 days. That's what the order is saying. Give the child the medication for 10 days. Don't mind the spelling, I'm trying. So now we have to calculate it in milligrams first. Do you understand? We know that for every 15 milligram, you give this. So if for every 1 kilogram, this is 1 kilogram per 15 milligram. Do you understand? Only this portion, leave the days aside for now. For every 1 kilogram that a person weighs, they are supposed to take 15 milligram of the medication.
Okay.
Now your weight is 40 milligram. Oh, 40 kilogram, I'm sorry. Now you come in and I check your weight. You are 40 kilogram. How many milligram of this medication will you take? That's what it means when you interpret the question. Do you understand what I wrote? I know it's not so clear. But for every 1 kilogram from here, every 1 kilogram, you see the pair, every 1 kilogram should take up to 15 milligram of the medication in 1 day. So we're leaving the days aside for now because the other one we know is 10 days. We know the child's weight is 40 kilograms, but we don't know how much of the 40 kilogram baby is supposed to take. So we have to get the medication in the kilograms. So now you cross multiply. That's what I did here. So we'll now have 40 kilograms by 15 milligram. Do you understand?
Yes.
Yes. So 40 kilogram by 15 milligram. So when we did that, we got 600 milligram or kilogram and milligram. Let me clean this and then write the whole thing again here now. Okay. So when we did it, we got 600 milligram over kilogram. You understand? I'm just using this unit and this unit. They also multiply. And this one will give us X milligram. Do you understand?
Yes.
No, it's X kilogram. It's the one that we consider. We consider only this one. We're not considering the milligram. So now you are going to divide the kg here over kg here.
Mr. Pat, what about the 1 kg?
Which one?
The 1 kg.
What is 1 kg? Here?
Yes.
That's what I did here. So you know when you cross multiply this one and this one, anything multiplied by 1 is still the same number. So if you are multiplying 1 kg by X amount of mgs, is the same 1 kg. It doesn't move anywhere. Okay. So I'm just dealing with the units right now. So when this kg will take off this kg, it will be left with 600 milligram. Because our priority is a 600 milligram, which we have here. So if we take the 600 milligram, it's supposed to be given, or it's supposed to be taken up to 10 days. So now our total will be 600 milligrams times 10 days, would give us the 6,000. Do you make sense from this calculation, Emilia?
Yes.
Does anybody have a question before I clean it? Huh? Anybody have a question before we move on?
No.
Please make sure you are understanding it, okay? Okay, so I'm going to take this question off. I assume we all understood how we got to our answer as 120 ml. Okay. Now our next question. Let me see if I have it copied up. Okay. Our next question. This is our next question. Can somebody read this quick for me?
A physician had prescribed a 10 milliliter of oral suspension twice daily for a child, but the mother is confused about the metric system and wants to know how many teaspoons of medication to give the child. How many teaspoons are equivalent to 10 milliliter of oral suspension? Record your answer using a whole number.
Beautiful. So if you are the one reading this question, how will you tackle it? How do you understand it? Patience, how do you understand this question? So you go to the doctor and the doctor order 10 ml of amoxicillin and tells you, give this medication 2 times a day to your child. You understand? Give this medication 2 times a day to your child. But you are confused. The doctor said, use a teaspoon to give this medication 2 times a day. Now, you don't know how many milliliters. You see on the thing is written some milliliters, but you don't know what it is. You want somebody to explain to you. So the teaspoon that the doctor said I should give 10 milliliters. How many teaspoons am I going to give to the child for the 2 times a day, morning and evening? So who can calculate this for me? And if you want to tackle this, how will you tackle this, Simone? How will you tackle this question?
Well, first I would find out what's the conversion of a milliliter to a teaspoon.
Yes,
So
so
I
I
will
will
just
put
try to get that conversion
1
done first,
teaspoon.
and then I can.
1 teaspoon is equal to how many ml? Is that what you would do?
Yes.
I'm writing your mind, okay? So X teaspoon or TSP is equal to 10 ml, right? So this question is looking for the answer as a teaspoon equivalent. It's not looking for the ml. The total ml is 10 cc for the oral medication. They want to know how many teaspoons you will use. So if I have a teaspoon here, how many will I give to my child so that it's not overdosed? So you cross multiply. And if you know how much 1 teaspoon is, you put that here. So how much is 1 teaspoon?
4.9. 5 ml.
5 ml.
5 ml, yes. So do we understand the difference between teaspoon and tablespoon? Who don't understand? Emilia, do you understand the difference between a teaspoon and a tablespoon?
Yes.
So you know that the tablespoon, how many cc is that one?
The tablespoon 10.
It's 10 cc, yes. So in all, they could have said just use a tablespoon. But because they want you to give the child in the morning 5 cc, in the evening 5 cc, they say teaspoon. Patients, do you know the conversion? Huh?
Tablespoon. Is it 10 or 15?
Tablespoon is 15.
It's 15, not 5, not 10.
Yeah, tablespoon is 15 ml. It's not 10. So tablespoon is 15, but teaspoon. So tablespoon is abbreviated as this, TBSP. So this is a tablespoon and it's 15 cc. I like to use cc all the time. So for 1 teaspoon, 1 tablespoon is equal to 15 ml. And 1 teaspoon is equal to 5 ml. So if 1 teaspoon is equal to 5 ml, how much is 10 ml? So you cross multiply this one. So somebody should cross multiply this and tell me the answer.
It's going to be 2 teaspoons.
2 teaspoons, right? Yeah, straightforward. Jethro, do you have a question on this? Huh?
No, I don't have a question.
Okay. So, Emilia, do you understand? Patience, do you understand? Huh? Does anybody have a question on this? Another one. A client is prescribed 250 milligram terbutaline subcutaneously, but the medication is provided. Oh, yes, this is the easiest of all. Can somebody calculate it for me in 1 minute? Using a decimal to 2 places. Can somebody do this for me in 1 minute? Clementina, Simone, Gertrude. Are we working on it? Okay, do we understand it? Do we understand the question? This is a straightforward question. If they give you this kind of question, I remember in my NCLEX, I got a question like this, and that was the easiest. You don't have to look twice. Mostly, the answer options will be there for you to choose, okay? Gertrude, I took off the answer options for these questions. There are answer options for you to pick. or I didn't give it out. I didn't give the answer options, but the NCLEX 2 with the mathematics calculations, they won't give you the answers to these questions. They won't give you A, B, C to choose. They want you to calculate and record the answer. They will give you a box to put your answer in. If you are lucky, they put the calculations and they want you to pick up, that's fine, but I really haven't seen that they put the calculations for you to pick. Mostly they don't make you pick it up. For the NCLEX, you have to calculate. Are we done yet, Simone and Clementina? So for every 1 milligram is equal to 1 ml, right? 0.25 milligram will be equal to what? XM. Emilia, cross multiply this for me, and we get our answer. So the medication, this is what pharmacy has delivered. This is what the doctor ordered. So your plan is to get the amount you are going to give to the patients. And we are done. Can somebody finish this calculation for me?
4, 5,
Huh?
6. Come on, look.
Hello?
How about it?
Hello? Can I move on? What did we get? I think I have 3 more questions. We have spent 2 hours on this. That was not my plan.
0.25.
Yeah, it's straightforward. The answer is there. Anything that you multiply by 1 is 1. Anything you divide by 1 is still 1. There's nothing to do with this question.
Right, 27. ABC.
So these are one of the easiest ones NCLEX will give you if you are lucky. So if you are one of the lucky ones like me, I was lucky. I got something like that. If you're not lucky, they'll ask you to convert something. I think I got 2 of them. If I remember, it's a long time, but I remember I got 2 of them. And but one was to convert. The other one, I just had to demonstrate. Let's go over this. Let's go over this question. This one is calorie. We are calculating calories. A client tells the nurse that she is she's on a high protein diet and average 75 grams of protein daily. So mark it, 75 grams is equal to 1 day. 120 grams of carbohydrates. Are you marking it? 120 grams of carbohydrates. 40 grams of fats. If fat is equal to 9 calories per day and protein, and carbohydrates are equal to 4 calories per day, how many calories is the client averaging each day? Record your answer to the nearest whole number. So we are talking about calories here. Can somebody tell me how we understand this question? Huh? So listen to the question. I'm going to break it down. A client tells the nurse that she's on a high protein diet and average 75 grams of protein. So I'm going to put 75 grams of protein here. So protein is 75 grams of protein daily. So all this diet is going to be on a daily basis. 120 grams of carbohydrate. So let me put 120 grams down as well. So mostly the calculation questions, this is where you use your paper. So grams of carbo, I didn't put the carbo. They want you to calculate how much. So it tells you that at the end of the day, you'll be adding something. You'll be doing a lot of additions. So 140 grams of fats. So the client will eat 40 grams of fat. Do we get it? This is how you break it down. Now, let's come to the second part of the question. So this is the amount the client eats on a daily basis. If fat is equal to 9 calories per gram, so where's my fat? Where's my fat? So fat is equal to 9 calories. So you are going to multiply this by this. So fat alone is up to this amount. So you multiply the grams to the fat per gram. So for every 1 calories is equal to 1 gram of fat. So if you want to add this one and multiply it by this, then you come here and then what's the second part? And protein and carbohydrates are equal to, so protein and carbohydrates are equal to 4 grams per day. So you multiply this by this. So most of the calorie calculations, you have to multiply them. So can somebody multiply all this for me? Just multiply the numbers for me and get me the answers for each of the amount. Because at the end of the day, you want to know the whole amount of calories the patient is taking. So our concern is the calorie the patient is taking. And we are not doing any division. You're just multiplying them and you'll be fine.
So 75 times 4 is 300. So
75 times 4 is 300.
yeah. And then 120 by 4 is 480.
480.
And 40 times 9 is 360.
3 what?
360.
350.
360.
40 times 9. Is it 360 or 350?
360.
Oh, 360. Okay. So all these things has been calculated, right? And they are all in calories. So can we now add them? Because your concern is how many calories is the client averaging each day. So you add 300.
1140 altogether.
1140 is your answer, yeah.
1140.
That's it, straightforward. Oh. Who has a question on this? So when they give you calories, it's just to multiply the amount of each calorie the patient takes by the particular vitamin or by the particular component given. And then when you finish, you want to know the average calories for the day. It's just like input and output. When you are doing INO calculation, input and output calculation, you're just multiplying or you are just adding the total amount for the whole day and you put your answer there.
Excuse me, do they present it in this format in the exam? Like to put the number, like 9 calories is for one?
Yes.
They put it that way?
If they want to confuse you, they'll just tell you, they can give you only carbohydrates and then they want you to convert, they can give you the calorie and they want you to convert the calories into the grams. They can give you only, let's say they give you fat and it tells you if fat is equal to 9 calories per gram. So they can require you to calculate the calorie before you do it. But mostly with questions like this that have to do with daily dieting, they just want you to be able to get a total. So the only thing they can use to mix you up is to take away 1 calorie, and they will demand you to do calculation of the calorie. And the calculation of the calorie will be for you to compare and then cross multiply like I told you. So you can say 120 grams will be how many calories? If 4 calories is for 1 day, how many calories should be for 3 days? If the patient takes it for 3 days, how many calories? So this one is for 1 day. If they tell you is, so before they can mix this kind of questions up, they have to tell you the days. They have to give you number of days. This one is just 1 day. So you want to know how many, or they can give you in hours. That's the only time they want you to do a cross multiplication to find one of the answers. So if they want you to find the calories, they'll frame the question, and then you know that one of them will not have the calories to multiply by the gram. So you can't move further. So for each 4 calories of each gram, the patient take a total gram of carbohydrate, 120 of it. Does it make sense? Here. So 4 calorie, right, per gram. Do you understand? So they will put 4 calories per gram, and they want to know how much gram. So they will give you that the patient takes 120 grams in 1 day. So if the patient takes this in 1 day, they want you to cross multiply. So if they want you to cross multiply this, then you are going to do it the same way I've been telling you. So it will be 4 equal to 1 gram. Like here, I'm just using this one. So 4 calories per 1 gram. So 4 cal is equal to 1 gram. How many calories will 120 be? That is in case they want you to calculate something. They'll question you that way in the question. So X amount of calories will be equal to 120 gram. So in this case, you cross multiply, and you'll be able to get your calories in 120 grams. That is if they want to go specific. So they can decide to let you calculate all of that from here. They want to know daily, only the daily calories for carbohydrate. You will calculate it this way. But this one, they wanted to know the average. So average will be all what the patient is taking. But if they pick only this one, and they want to know how much of the daily protein with a calorie of 3 does the patient get, then you have to do this and cross multiply. Does it make sense?
Yeah.
Yes. Yes.
Huh?
Not answering for everybody, but for me, yes. Thank you.
Yeah. Okay. I had said yes to. Patients Emilia and Gertrude, does it make sense to you with this calculation?
Yes.
Yes. So that's how NCLEX will always
Yes.
present it to you. So take note. I have 3 more questions, but this one here is not a calculation. I just wanted to show you this one. That's why I put this question there. A client is receiving oxygen therapy at 3 liters per minute nasal cannula. So the amount the patient is getting is 3 liters per minute via nasal cannula. Okay. Which of the following fraction of inspired oxygen measures does the nurse expect that the patient will receive? So this one have answer options. I just took them off. So I'm going to explain this to you. So the fraction of inspired oxygen is this one. I know most of us, we see this one a lot, but we always ignore it because it's kind of confusing. Who has seen FiO2 before?
Me.
You know the formula? So
no.
If they tell you the patient take 3 liters of oxygen, how much of the FiO2 does the patient get in total? Now, let me show you how to calculate FiO2 for any liters of oxygen the patient take. Naturally, the air we breathe in has 21% of FiO2, 21% of fraction of inspired oxygen. The rest is carbon and other gases. So the natural air we breathe has 21% of FiO2 and 79% of nitrogen at all times, and some traces of gases. So if naturally the air I breathe in right now is 21%, right? It's a standard number. So the air you're breathing in and out is already 21%. Now, if you get 1% of nasal cannula through your nose, that's an extra air you are getting, extra oxygen you are getting. So remember, when you are breathing without any support, you are fine. But the moment they put a nasal cannula through your nose, they are giving you oxygen support. They tell you, oh, the patient is getting 2 liters. Set it at 2 liters. So NCLEX want to know if you know the amount of the percentage of the oxygen you are giving for the 2 liters. So the standard we always give is 2 liters, 3 liters. The patient with COPD, you don't want to give more than 3 liters. So if you are giving the patient 2 liters of oxygen, how much percentage of the oxygen are you giving if they put it as FiO2? So the baseline is 23. So if the baseline is 23, you always want to add it. So for every one liter, for every 1 liter of oxygen that you get, so for every 1 liter of oxygen a person receives, is expressed in fraction as 4%. So it's expressed as 4%. So take notice of this. It will confuse you over and over. So for every liter of oxygen you get, the 1 liter is 4%. So if I am already breathing naturally, before I calculate the percentage of oxygen a person is getting, then I have to add 4% to it. So if I add 4% to the already one that we have, how many liters will this patient be getting? Question. Can somebody tell me?
25.
25.
Is it 25? No.
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 Okay. So listen, I'm talking about liters. I'm talking about liters here.
4% of 1 liter, is that what you mean?
Huh?
When you have 1 liter of oxygen equals to 4%, and I say, is that 4% of the 1 liter? Okay, go ahead, continue the explanation.
Okay. So if I am getting 21% as a standard fraction, now you are giving me 3 liters. So the 3 liters, I'm going to add this one. You are going to add 444. That's how much? 12, right?
That's 12.
Yes.
Yes.
So for every 20, even though the fraction, every 1 liter is supposed to be added as the 4%. But for every 1 liter a patient gets, it's expressed as a 24% oxygen. It doesn't use odd numbers. That's why we don't have 25% of oxygen. 25% of oxygen. I'm not the one framing this. It's a standard. So you can't have 25%, you can't have 31%. You understand? Because it's a standard number. So for every liter of this, what am I saying? Yes, so for every liter of the oxygen that you get that is extra, you are going to add it. You are going to add it. The already one that we have. So 1 liter.
So that would be
1 liter of oxygen. So 1 liter of oxygen is equal to 24%. They have some other formulas that will give you different ones. So mind you, this one I just explained. They have some other formulas that everybody use a different fraction for the FiO2. But for the purpose of the NCLEX, if they want you to calculate the FiO2, just have 24% as 1 liter of oxygen. Then if they tell you the patient take 2 liters of oxygen, you set the nasal cannula to 2 liters. Mine is tired. So for every, yes, so for every 2 liters, the patient will get how much?
48?
Not 40, you are not multiplying, you are adding 4% to every liter, starting from 24, which is the baseline. So far as the patient is getting oxygen right now, and it's 1 liter, the patient is already on 24%. So if the patient is getting 2 liters, you are adding 4 to the 24.
Okay, so that makes it 28.
If the patient is getting 3 liters, you are adding 4 to the, you are adding 4 to 2 liters.
The baseline, which is 24, right?
You are not jumping the line. So the patient is getting 2 liters now, the patient gets 28%. Now the patient is getting 3 liters per minute. Emilia, I heard you. Give me a minute. I'm coming. So the patient is getting 3 liters. You are adding 4 to 28, which is how much?
32. I get you now.
So for the purpose of the NCLEX, this is how you learn the FiO2. Don't come back to study it. Understand it that way. So they ask you, a patient said, I'm getting 6 liters of oxygen. Let your mind tell you. So 6 liters of oxygen for every 1 liter is already 24. So I'm going to add 4, 4, 4, 4, 4, up to 6. And then I'll get the percentage the patient will be getting. So the answer options will be there.
Why, Mom?
If the answer options are there, you just add in this one, and then you get your 6 liters of oxygen. Does it make sense with the FiO2?
Yes. So we have to have at the back of our mind that the baseline to calculate that is 24. Yes. Then additional 4 for every 1 unit. Right?
So
okay, I got you.
Minus oxygen. If I am not getting oxygen, like you and I sitting right now, nobody is on oxygen. So your baseline is already 21. You're already getting 21. You understand? But the moment you put oxygen in my nose, then the percentage is the question. How much of oxygen am I getting? Even though we always talk about liters, but you need to know the FiO2. So the liters, some of the doctors will not tell you give 2 liters. They will tell you, oh, give the patient 40 FiO2 or give the patient 42 FiO2, and they walk out. So you should be able to calculate it in liters. So 40 FiO2, how much is this? So the patient is COPD. The doctor said give the patient 28% of oxygen, and they walk out. So you should be able to understand that for every 1 liter a patient gets is 24. For the next extra liter, that is 2 liters, you add 4, making it 28. Doctor said 3 liters. You add another 4 to the 28, making it 32. And thereabouts. So 4 liters will be how much?
And that will be 24 plus 4. 30 something. Hold on.
So 4 liters will be how much?
36.
That's it. And then 5 liters. How much?
40.
36. 36.
5 liters will be how much?
36.
5 liters.
40.
6 liters will be how much?
44.
Oh, I didn't do it right. Okay.
That's it.
34.
Do we understand? Emilia, you had a question before? Huh?
No.
Gertrude, do you understand? I have 2 more questions. Should we stop? Huh? Or we should finish it? Huh?
Let's finish it.
Okay. All right. Sir?
So the correct answer is 32, then, right?
Say?
The correct answer is 32?
Yes.
Okay.
Listen, Emilia, Patience, and Gertrude, you don't have an excuse for these questions, you know? That's your week 2 exam. I'm giving you the leakage. I know I'm almost done, but I'm giving you the leakage. I don't want to see any of you get wrong in any of those questions. I didn't say write it down. I didn't say capture the screen. That's why I'm taking them off. I want to see how much you understand. So if you have this one in mind, it will give you a booster to practice working them on your own. That's why I really didn't want to work them on the screen like this for you guys. So because I want you to put hands on, I want you to practice it on your own so that you'll be able to understand them. And because you don't want to be going back doing calculations when you have a volume of material to actually study for this NCLEX. So a hospice client is to receive 4 milligrams of morphine subcutaneously from a vial, that contains 10 milligrams per ml. How many milliliters of morphine sulfate should the patient receive to equal a dose of 4 milligrams? Record your answer using 1 decimal place. Who can do this? Patients, can you interpret this question for me? What are they talking about? Can you interpret this? Gertrude, I'm waiting for you too. Can you interpret this question for me? How will you work it? What will be your setup on the exam? Remember, on the exam, they don't want you to show plenty working like this. Can you see my paper? I know you said you couldn't see it.
This one is fine.
They don't want you to go showing working like this. They give you a worksheet. They give you a paper to do all your practice. The only thing they want you to put down is the answer. So if it's 6, you put 6 in the square box. That's it. They don't care. It's not like in Ghana where the teacher will follow and mark, okay, from here you're able to put the formula correct. From here you're able to work it correct, but your calculation ended up wrong. No, you're not getting a partial mark for this. So you either know how this question is set up, or you just don't get anything on that test. That's how the NCLEX set it up. They don't give a partial mark. So even if you select all that apply questions and you get one option wrong, You can get 2 of them correct, but so far as you didn't get a 3rd one right, you still lose marks. You lose the whole question. So mind you, that's how NCLEX set up for you. But before that, let's see who can explain this. Gertrude, I'm waiting.
Okay, I got 0.4.
You got how much?
0.4 mils.
Okay, can you explain to us how you calculate it?
Okay, so 10 milligram is equal to 1 mil.
Okay, hold on. Patience, once you finish, you are going to explain to me your working too. You said 10 milligram is equal to
1 mil. 1 mil. So 4 milligram is equal to X mil.
Perfect.
So if less, more divides. So I divided 4 over 10 times 1.
That's it. That's it. Is anybody confused about this question, Simone? Hello? Simone?
I'm sorry, I didn't hear that.
Do you know how to set up for this question? I want to believe Gertrude stated it clearly. So
1 mil, 4 mg.
And they said the total, they said how many milliliters should a patient take to make it equal to 4 milligrams? That's it. So patients, can you give me the explanation of this question? Do you understand it? There's 2 ways to this thing. Number 1, if you don't understand the question, what the question wants you to calculate, you won't get it. Number 2, you have to know which units they want you to calculate it. So if you need to convert, they're not going to tell you to convert something, but you need to know which unit you want your answer to be in. So if I know that they say how many milliliters of morphine sulfate should the patient receive, that means that's what they want. So my answer should be in milliliters. So all my workings, if I don't want to get confused, I don't drop these measurement symbols. I don't drop them because I want to be able to remember that I'm working towards getting my answer to be in milliliters. Those are the 2 options you need to have in mind. Number 1, make sure you understand what the question wants you to answer. The second one is make sure you know which units they are looking for, and then which one are you supposed to convert? Is there any conversion? Is there no any conversion? Those are the things you look out for. But if you don't understand this particular question, that at the end of the day, the patient is supposed to get 4 milligrams. So it doesn't matter what I do, the dosage the patient gets does not exceed 4 milligrams of morphine. So Emilia, what do you understand with this question? Do you have any concern, any question? I have another milligram per kilogram question coming, and that's the last one. I would want you guys to work that one. I don't want to work it. Yes? Patients, do you understand this one we're doing now?
Not really. So this one, what is the answer?
Read the question. I want you to read the question because I've worked similar questions. So read the question for me.
A hospice client is to receive 4 milligrams of morphine.
It's supposed to be
of morphine. subcutaneously from a vial that contains 10 mg/ml, how many millimeters of MS should the patient receive to equal a dose of 4 mg? Record your answer using 1 decimal place.
So what do you understand with this question? What are they telling you? If I walk in and I say, what does this mean? What are they talking about? How will they explain to me? Because I want to make sure that if you go for the exam, you'll be able to interpret the question to yourself. Because all the questions you are going to answer, make sure you interpret them to yourself. Understand the question before you tackle it. So, because you are going to get analytical questions. Those are the passing level. They have passing level questions and non-passing level questions. So I'm going to tell you guys one of these days about those that are passing level questions and how they should look like. What kind of questions? I'm not saying when you go, be eager looking for passing level or non-passing level questions, because they have 25 questions that are you taking a picture of the screen?
It's coming. Oh no, it's coming.
Huh?
I am.
How will you explain this one to your mother?
Confused on this one.
Huh? I'm listening. Somebody was talking. Emilia, how will you explain this question? Gertrude answered it, and she's correct. She worked it out, and she's perfectly right. So what Gertrude said is what I wrote down, but I didn't finish what she said because she finished and she got the answer. So, Emilia, how will you interpret this question? I thought this one is straightforward English, so just explain it to me. Mm-hmm. Yes. So what do they want you to do here? That's my other question. What do they want you to do? Anybody knows? Simone, do you understand this question?
Yeah, you have to convert because I noticed they are using grams and milligrams. Oh, did I?
They're
Everything is milligrams. Okay.
Everything is milligram and ml. There's no conversion. Yeah. Even though I switched these ones based on reading the question. How many milliliters of morphine sulfate should the patient receive to equal? How many milliliters should the patient receive to make it up to 4 milligrams? That's why I switched it. So I just copied this one and I posted it. But the second part said, how many milliliters of morphine? Remember, the order says morphine sulfate, right? So the order says 4. And you go to the vial, you pick the medication vial, and it's 10 milligrams for each 1 ml you take. So for each 1 cc that you are going to draw from the vial, each 1 cc will be 10 milligrams. But this patient is supposed to get only 4 milligrams out of that 1 cc. So if you are going to use a string to draw it, how much of the medication will you draw it inside the medication? Because if you draw up to 1 cc, that means you are drawing 10 milligrams of morphine. But the doctor didn't want the patient to get up to 10 milligrams. You have to draw only 4 milligrams. So for each 1 cc that I draw, the 1 cc is 10 milligrams of morphine. Are we understanding this explanation now?
So, Sister Pat, so every 10 milligrams is equal to 1 ml, right?
Yes. So if I have the syringe here, this is my syringe. This is the medication vial. Pharmacy said 10 milligram, pharmacy put on it 10 milligram per 1 ml. So
So is it the standard?
That's what the pharmacy is delivering. There's no standard of every medication. Pharmacy have the standards to deliver for each medication they want to deliver. So if they put it, if they tell you 15 milligram is 1 ml, pharmacy will write it on it. That's how they have, that's the concentration of the medication. You are not worried about that. You understand? Pharmacy have already mixed the medication. So they tell you that if this is my medication syringe, then I'm going to put it inside to draw. You understand? I'm supposed to give the patient 0.4 milligram of the morphine. But for each 1 ml that I will draw from this vial, the 1 ml will be 10 milligram of morphine. So I cannot give the patient 1 ml. Now, let's take the small syringe that have the 0.1, 0.2, 0.3. How much will I draw to make it 0.4? Instead of drawing 1 ml, you know 1 ml will be very tiny. And the tiny 1 ml is already 10 milligrams. I just need 4 milligrams. So if I need 4 milligrams, I have to cross multiply here. So for this 10 milligram to be 1 ml, that 1 milligram to be 10 ml, then every 4 milligram that I'm supposed to give, how many will I draw in the syringe, in the medication syringe for it to reach? Then you cross multiply. Can somebody cross multiply and divide this for me? Patients, do me a favor. Cross multiply.
10.
Get your phone.
10 divided by 4.
10 times
That's
is
point
10. 4 times
0.25.
1 is 4.
And remember, your answer should be in ml. That's what you're looking out for.
2.5.
So if I have 1 milligram, it will now be 10 milligram x. Oh, what am I writing here? Okay, so it will be 10 milligram and mil. And I'm looking for the answer. So this one times 1. So down here, I'm going to divide 10 mil, 10 milligram, because I want my answer to be left with mil. So I come here, 10 milligram. Do we understand? So milligram, cancel milligram. I have 10x here. So 10 here will go with the 10, leaving the x mil. I'm looking for my answer to be in x mil. So this one divided by this will be 0.4. And the milligram here will cancel milligram. I had mil here. So it will now be 0.4 cc. So that's the answer. Do we understand it? Huh?
Yes.
Anybody has a question? Simone, did you understand?
So, okay, yeah.
All right. So let's go to the last one.
No. Okay, this one.
The last one, I'm going to have you guys work it out. So I'm going to give you 5 minutes to work it out. Are we working it out?
Yeah.
Okay, let's work it out. So today we cannot tackle our renal system because our time is fast spent. And we didn't even get a break. Okay. So when I finish, I'm going to stay over. I'm going to make a lesson for the renal system, and I'm going to send it to you guys. I don't want to keep moving it from week to week, so that when you go over it, you contact me with questions and concerns that you have. So make sure you go over the video and ask for questions. Write the questions down. The next time we meet, I'm going to make time to take your questions on the renal system. I'm going to ask you questions on the renal system before we go. So you would have listened to the video, because I'm going to explain it. I'm going to explain stuff in the video, and then I'm going to send it out to you. And you read the material. I sent it to you. Did you get it? Are you reading? Are you writing the answer, Clementina? Emilia and Gertrude, what's her name? Gertrude says she has to work in the morning. She's off. And Simone.
Yes, I'm here.
You working it up?
Mm-hmm.
I hope these questions are helpful to you. Simone.
Yes, it is.
Are you understanding? Because I want you to put that in your daily practice now.
Yeah.
Yeah, because this week's assignment, it has some few, not too much, but it does have a few of calculations as well. So I wanted you to go over that before you can do it. I'm waiting. Who is finished and who is going to explain to me? Because the last question, I don't want to answer it for you guys. And after this question, we are going to close because we cannot do another system today.
Oh no, it's breaking. It's breaking now. It's going to break it. Going to break it. Going to break it.
So remember that for this question, when you get your total milligrams, for 24 hours, they said it's for every 12 hours. So when you get it in 24 hours, you have to divide 24 hours divided by 2 is going to give you 12 hours. So for every 24 hours or every full day, you have 12 hours. So you're going to divide the total milligram by 2 to get it for 12 hours before you work it out.
Can you scroll the question up a little bit?
Are you seeing now? Oh, you see that I'm moving it, right?
I cannot see it.
A child weighing 20 kilograms is to receive 40 milligram per kilogram of amoxicillin per day in a divided dose every 12 hours. Remember, the oral suspension contains 250 milligram per 5 kilogram. How many milliliters should the child receive in each dose? So it's similar to the one we worked before.
Oh no. I can't help. I'm tired.
Are we done? Who is finished?
Mommy, look. Okay.
I don't know if I'm right.
You say?
I don't know if I'm right.
Okay.
I sent you a chat.
That's a big number, Clementina. That's really a super big number. Did you divide it by 2? So Simone, I see your number. Your number is good, but it's not correct.
I'm not finished. I missed a part. That's what I'm kind of stuck there.
The answer is less than 10 though. The answer is less than 10. I can give you guys the answer.
I didn't. Okay, so all right. Okay. I don't know.
Yeah. Let me give you a hint. The answer is actually 9 ml. But how you arrive at the 9 ml, let's see. Because NCLEX is not going to bother about the calculation process, the steps you take. Is the final answer. I don't know how much you guys are scared of mathematics, but when you understand...
Is it 450 divided by 5? Because originally, when you multiply 20 kg by 45,
you did what?
45, you have, when you multiply 20 kg by 45 mg,
it's 450 each dose for every 12 hours.
That's what I'm saying. Now you get for every 12. Okay, that's why I made the mistake. Because I multiplied 20 to get 20 with 45 to get 900.
I know you got the 2250 you got was on track. The 2250 was on track, but you have to further divide that. And look for what you divide that with.
Should be true. Because this should be the daily dose. The 24-hour dose.
If it's daily dose, we're not looking for daily dose, we are looking for 12-hour dose. That's why you got the 450 in the first place. Patients, how are we doing? Emilia, how are we doing? Emilia, are we getting it? Patients, are you catching the concept?
So with the 12 hours, are we converting it to minutes or what?
No. You're looking for the milligram the patient would take for every 12 hours. Remember the first question we answered per kilogram per body in 1 day and the 10 days? We have to multiply it by the 10 days. Now they are giving us 12 hours. 12 hours. So if we know that it's 12 hours and we get it for 24 hours, we can divide that by 2. We can divide our answer by 2 to get it in 12 hours. Because 12 hours divided by 2 is 12 hours divided by 2 multiplied by 2 is 24 hours. Weird. My children are outside this night playing ball. Can you imagine? What kind of ball is it that we have to play in the night?
Can we go over it? Because I don't know where I went wrong. Can we go over this one?
You can't get the answer?
No, but can we go over it? Because I want to see where I went wrong.
Oh, you want us to go over it?
Yeah.
Okay. Who is ready? Who hasn't? Who is ready? Can we go over it?
So my final answer would have been 7, but you said that's not the correct answer.
Yeah, the answer is actually 9.
Yes, I want to see.
Emilia, have you gotten an answer? Have a patience. I did get Emilia and Clementina send me their answers in the chat, but I didn't hear from you guys. Yes. Can we go over it? Are we ready?
Yes.
Emilia, I can't hear from you. What's up? I didn't hear anything from you.
So,
did you try it or it's not working? Huh? Emilia?
I'm stuck.
Stuck? My baby will say, Mommy, I stuck. I stuck. Okay, let's go. Don't be stuck. Let's go. Okay. So a child weighing 20 kilograms. So the weight of this child is 20 kg. Is to receive. So the doctor have ordered this one. Amoxicillin in a divided dose every 12 hours. So the child will receive a divided dose times 12 hours. Right? So let me put an equal sign. The oral suspension contains 250 ml, 50 milligram per 5 ml. Do we understand this setup I'm putting up? Okay. So let's leave the 12 hours aside. So for every 45 milligram, the child, for every 45 milligram, is supposed to be given to 1 kilograms. So a child who weighs 1 kilogram will take 45 milligrams. Now this child is weighing 20 milligrams. How many milligrams of the medication will the child get? First of all, that's where you want to start your calculation from. So let's put this one aside because that one is a standard order that pharmacy have delivered. So this is pharmacy's business. So we put that one to the corner. So this is pharmacy, and that's what they want to bring. But now the standard says for every 45 milligram, right? It should be equal to, it should be given to a 1 kilogram child. Now this our child here that is supposed to get the medication. Our child is, we don't know the amount of milligram our child will get, but we do know the kilograms. Our child is 20 kilograms. Okay, so you send your baby to the clinic and your baby's weight is 20 kilograms. But the medication has a standard that says for every 40 milligram, the child's weight should be 1 kilogram. So for every child that weighs 1 kilogram, should take 45 milligram. So every child that weighs 2 kilogram should take, let's say, 90 milligram. Do you understand? You should double. Now our child weighs, it's now 1 kilogram. Our child is 20 kilogram. Because 1 kilogram will be a preemie baby, premature. So my baby is 20 kilograms. How much milligram of the medication should my child get in 1 day? Because if I finish calculating this, it will be a 24-hour calculation. Because remember, here it says milligram per kilogram of amoxicillin per day. So that's how you analyze this question. So this child, if this child is taking this one is equal to 1 day. But for what they want us to calculate, using the weight of 20, we should give it for only 12 hours. So pay attention to the calculation. So for this milligram, for every 1 kilogram, the amount to get is 45 milligram, and that should be given in 1 day. And we know that 1 day is equal to 24 hours. Do we know that? Are we all paying attention to this? Because I want you to understand it by the time I finish. So I'm continuing the statement. So for every 45 kilograms per kg, it should be given in 1 day. It should be given in 1 day. But the other want us to give it, to divide the dose and give it every 12 hours. So every 12 hours, we are probably given half of this. So for every 45 milligram, the weight has to be kilograms, and it should be given in 1 day. So every 1 day, we also know is 24 hours. So 1 day is equal to 24 hours. So if 1 day is equal to 24 hours, we are not yet worried about the days right now. Trying to get the total milligram before we think of the days. So here we are going to just cross multiply. The usual cross multiply. If less, more divide. So this is what we are going to do. So for some people, somebody will go ahead to add equal to 12 hours, because we are looking to give this one in 12 hours. So that you have 45 milligram per kilogram per 1 day. And then you have X amount of milligram per kilogram for 12 hours. But like I tell you, you don't want to get confused yet. So don't worry about these ones. So you cross multiply. Can somebody multiply 45 by 20 for me? And let me know what the answer is. So 45 milligram by 20.
900. 900.
We have 900 milligram in 24 hours. Do you understand?
Okay. That's
so when we calculate, when we use this one, when we use this one, we are calculating it for a 1 day period. Because for the whole day, if you are 1 kilogram for the whole day, you get 45 milligrams. Not worried about the 12 yet. Now that we have gotten this 900 in 24 hours. So if we have this 900 to be given for 24 hours. Now, we want to know how much of the 900 will be given in 12 hours. So X milligram will be 12 hours. So we know our 12 hours. Do we understand? But in this case, we already know that for every 24 hours and 12 hours is half of it. Are we getting it? So instead of crossing multiply, we'll get bigger numbers, too big numbers. So we just need to say, 900. We are taking half of it. We're taking half of the 900 to be our 12 hours because 24 hours divided by 2 is half. So we are just going to take the 900 and divide it by 2. Here's my
That's going to be 450.
And divide it by 2, which is equal to what?
450.
450. So now the total amount the child is supposed to get is 450 milligram per 20 kilogram. That's the child's weight, okay? In 12 hours. Now we have changed the statement to suit us. So this is it. This is how much the child will be getting for the 12-hour period. Who has a question this far before I continue to the next stage? Patience, are you understanding?
Yes.
Okay. Emilia, do you understand? Huh? Emilia, you're muted. Can you tell me where you were stuck?
Yes.
Where were you stuck?
Was right from the 45. Then I guess.
Okay. All right. So Simone and Clementina, are we getting it right to this point? Okay.
Yeah.
So now let's put this in the formula. So we know that the formula, who can now finish it from here? Can somebody finish it? Somebody be able to finish it from here, or I should just finish it? Our time is spent. So we have 450 milligram. Oh, remember they gave us this one before, right? So if they gave us this one, and we have gotten 450 milligram for the child's weight, what is our X amount of ml that we'll need? That's all you have to do from here. So cross multiply from here. And you divide. Okay. Do we understand? So at this point, you are going to cross multiply. So we'll have 450. Can somebody multiply 450 by 5?
$22.50.
Huh?
$22.50.
20 what?
2,250.
Okay. So we have 250 milligram X. So when you multiply, you had what? 2,2250 is equal to 250, right? 250. So 250x. So now we are looking for x. So 250 milligrams. So x, divide this and let me see what the answer is.
9.
Did we get 9?
Yes.
Beautiful. So who has a question?
Can you resend this assignment so we could try to do it over just for practice, please?
You said?
Can you resend this assignment so we could do some practice with it?
Sure. Sure. I can look for different ones more though.
Yeah, that's different.
Oh, for more practice, look for more. We're supposed to get comfortable with it.
Okay.
Yeah.
I will look for more. But try to understand the formulas and the conversions. Try to make a meaning from the question first, because the moment you miss the understanding of the question, you cannot answer it right. But when you read questions like this, try to interpret it to yourself. So for this question, if you understand that the patient, just use yourself as the example. I sent my baby to the doctor. My baby's weight is 19 kilograms. And the doctor gave me an order of 45 milligrams to be given in 1 day and divided for 12 hours. So 1 day is 24 hours. So if 1 day is 24 hours and the pharmacy just gave you 250, so anytime they say the medication has been delivered in this per this, or the suspension comes in, the suspension contains, this is what pharmacy have delivered to you. So this one will always be a standard figure from the pharmacy. That's why lately nurses don't do calculation. So we have become lazy. So before pharmacy comes, they put on it 250 ml is equal to 5 cc. And the doctor orders 750. So I pour 3 cc, I'm done. I don't need to go and do calculation. So note that pharmacy will put it on the bottle. That's what pharmacy is delivering. So the one that will always give, they will always give you is the standard from what pharmacy is given. Then they want you to convert one of these things. And you need to remember the dates. They said it's to be given per day. Per day. This one makes a big difference. This is the one that will tell you to divide the dose into 2. So a day is 24 hours. So you divide it into 2 because half of 24 is 12. So you want the patient to take the whole dose for 24 hours in divided doses. So 2 times a day. So if they say 2 times a day, that means 2 times in 24 hours. Okay?
Yes.
So just before we leave, I wanted to give you this one. It's a food for thought. I'm going to talk about it, but I don't know where I put it yet. Let me look if I can find that document. A little gist about okay. So I'm tackling the oh boy. These are the area. I just want to give you the areas the NCLEX test you on when you are practicing. I don't want your mind to make you so comfortable, Amma. You are just learning this content and you are just trying to understand only the content, and your mind is not making you to critically think and analyze the content. Because if you know this content, You have to learn another option of how to utilize this concept, be able to make a meaningful judgment of how you pick the correct answers. So I will go over this with you guys, but for now, this is just a food for thought for you. So we have the recognition, we have understanding, we have application, we have analysis. For those who have taken the test, you already know what I'm talking about. So this analysis are what they will give you a big scenario, and they describe the whole scenario process. They describe everything, and they want you to be able to figure out what is going on. Like if they want to talk about, if you guys remember the last question I was talking about, you walk into the patient's room and the patient's blood pressure is dropping and the heart rate is going high. And I told you the patient had a incision and drainage procedure on the back, on the buttocks, because the patient had an abscess. If you remember that question, that was an analytical question. You should be able to analyze that when there is infection, when there is possible sepsis. These are the vital signs to be able to see. So you should be able to see the vital signs and make a critical judgment. You should be able to analyze it to get a correct answer. And questions that require you to analyze the situation and be able to figure out the answer are the passing level questions for the LP. Questions that require you to critically analyze. They're not going to tell you, oh, what is the symptom of hepatitis B? And then they go straight, they put jaundice there. They're not going to tell you that. They are going to give you symptoms. They are going to give you vital signs, and they want you to be able to use the vital signs to analyze. They are going to give you skin color, skin tone, dehydration. They are going to give you taste. They are going to give you a lot of symptoms that you'll be able to think. So if the patient has hepatitis B, what are the signs and symptoms, and what can this happen? What can that go wrong? You'll be able to analyze it in your own way to figure out the answer. Those are the passing level questions. For the question that will just ask you straightforward, what's the nurse knows that after the patient have gone for a liver biopsy, what is the next thing you should do for the next 30 minutes? Everybody will tell you bleeding. They will you have to put pressure on the site for 30 minutes. So that is a straightforward recall. You are just remembering the contents, but you are not really analyzing anything to understand the question. You just remember, oh, in the content, I saw this. Those are not passing level questions. I'm going to get a day and give you examples of questions that when you are answering them, you see this week 2 exam that I just gave you guys, they were standard questions. They were not questions that will really make you figure it out. Even though I had some few of content questions that were straight from content, I did have a complex one. It was a complex one. I had like a lot of analytical questions inside for you guys to analyze. And that was the LPN standard. These ones, we are just answering the medication calculations. They are all LPN standard. They are all LPN standard questions. So you should be able to analyze those things. So the exam is not so cheap. You know that you need to be able to analyze it to get correct answers. Now, questions that are just for you to understand and then make a clear judgment, they lead you straight to the answer. It's still part of the straight remembrance of the content. But for these 2 questions, those that you apply knowledge to, those that they ask you a procedure, drag and drop. How do you do this procedure? You are applying your knowledge. You're pulling up your brains to be able to make up the correct thing to do. Those are the passing level questions for the LPN and the RN. So take note of that. I just wanted to come your way to let you remember when you are doing these studies, when I am doing these discussions with you, that's why I urge you to be fully participating, fully into them, because I cannot really push it harder, but I can tell you that they have things that you will study and you will not pass. So when I give you the content, you need to push yourself further, especially when I give you the weekly exam. Don't think some questions are cheaper, others are difficult, because the NCLEX, some are straightforward questions because we have the 25 questions that does not count towards your grade. The bonus questions, the 25 bonus questions. So you will not know which one it is. But if you keep getting questions that are just recall and recall A to Z, you recall all of them and you come out and you are smiling and you didn't make it. So don't look for the easy ones. These calculations, I'm telling you, those ones, usually they don't twist them too much. You just need to have a clear understanding of how to analyze it and solve your problem. But when it comes to the disease component, I'm going to get time and then I dig more into this one. And I give you examples, questions that will tell you that you are analyzing harder, questions that will tell you that you are just applying your knowledge. And those two levels will make it the passing one. And questions that will show you have understanding, which is the minimal one. And then that is when you are getting so many, you are getting correct, and then you get wrong. Then they give you an understanding question, you get it correct, they jump it to application. They're trying to figure out where you fall. But where they're giving you recall and you're getting it correct, then they give you understanding, you get it wrong. They give you application, you get it wrong. Analysis, you get it wrong. They take you back to recall. And then they recall, you're getting it correct, but you are not passing with those ones. So don't think it's the NCLEX, don't think it's the LPN. Sometimes LPNs like to think that they'll be like, oh, mine is just an LPN, ours is, somebody will tell you to even register for LPN because that one is cheaper. It's not cheaper. You still need to be able to analyze. So just study and study it well. Okay? I'm tired. Can I take a break and we meet next week? I'm not really sure yet if we can meet next week, Monday or Tuesday, but are we able to meet on Tuesday? Or who is not going to be available? If I could get you guys available on Tuesday, it would be nice for me. Who will not be available on Tuesday? Who will be available? Please let me know.
We'll go to night on Tuesday. We'll go for night.
Hold on. You work night?
Yes, every day, night for 6 days in a week.